So what we're going to talk about today is just a brief review of the benefits from quitting smoking. I'm going to throw in one clinical pearl, and then we're going to go through tobacco control policies, and hopefully we'll have enough time for questions. So let's go to the next slide. And we showed this last time, but I just want to walk through it again because it's so important to show that you get short-term and long-term benefits from quitting. And I call your attention to the slide about the lungs. It's the top right, 1 to 9 months. So one of the things that you might hear about is if people stop smoking, they may cough a little more. Why is that? Because when you smoke, you get a lot of goblet cells in your bronchial tubes that you shouldn't have. And the cilia, the little fine hairs that do good housekeeping vacuum cleaning, are atrophied. So the goblet cells will produce their mucus, and the new grown cilia will bring them forward. So for the first 2, 3, 4, 5 weeks after quitting smoking, some of your patients, some of your clients may actually say that they're coughing more. That doesn't mean that they're getting better. That's just pulmonary housekeeping. Next. And just to, again, we showed this last time, it's never too late to quit smoking. And the next slide is a slide I didn't show you. This just shows you that at any age, if you stop smoking, you reduce your risk of getting lung cancer. So the bottom curve is the risk of getting lung cancer of never smokers. The next curve up is if you stop at age 30, 40, 50, 60. And the bottom, the top curve is if you keep smoking. The one right below that is if you stop at age 60. So at age 75, you can see the big difference between those who stopped at age 60 and those who keep smoking. So this is very important for you to be able to tell people that at any age, it's not too late to stop smoking. Okay, next. So this is not a complicated formula. It's that the number of smokers is a function of new smokers plus old smokers minus the quitters. And you can quit in 2 ways. You can die, and unfortunately about half of smokers die, or you can actually quit. And on the next slide, we intersect with quitting and policies. So quitting is a function of trying to quit, the number of quit attempts, and then the probability that the quit is going to be successful. So what stimulates someone to quit smoking? One is the price, and I'm going to go over regional differences in prices soon. Clean indoor air laws, and there are differences there. Counter-marketing, such as you see on television. The advice from a clinician, and then the probability that your quit attempt will succeed is a function of advice from the clinician, plus more in-depth counseling, plus any of the 7 different drugs that help you to quit smoking. Next. So these are public health actions in this country that have led us to a modern low in smoking prevalence. The federal excise tax, the 1964 report of the Surgeon General, which clarified that science shows that smoking can produce lung cancer, the banning of TB ads in 1970, local and state smoke-free ordinances in 1973 going on up to the present, encroachments on giving cigarettes to soldiers and selling them in the VAs. And I should note that all of these, and the ones I'm going to show on subsequent slides, were vigorously resisted by the tobacco industry. Next slide. In 1990, smoking was banned on airplanes. They did that in a 2-step fashion. At one point, you can smoke in some zones and not in others. So if you're in a non-smoking zone, you walk to the bathroom, you go through a smoking zone. Clearly, airplanes did not have impenetrable barriers, so that was sort of a farce. But then it was banning an all plane for the whole plane. President Clinton banned smoking in federal buildings in 1997. The Master Settlement Agreement resulted in a major payment to 46 states, plus the creation of the Legacy Foundation, which produced the Truth Campaign. And the Master Settlement Agreement occurred to reimburse states for the cost of treating Medicaid patients who had smoking-induced illnesses. Now, the Big Apple was not the only city to ban smoking in bars and restaurants, but it was the most famous one. It was stimulated by Mayor Bloomberg and then Health Commissioner Tom Frieden, who then went on to become the head of the CDC. Next. In 2004, there was establishment of the National Quit Line, 1-800-QUIT-NOW, which you can call from any state, and it routes you to your local state quit line. In 2009, the FDA was given regulatory authority over tobacco products, which is still a potential authority, but it may come to real fruition. And most importantly for this call, the HUD ruling on smoke-free public housing. Now, all these policy actions were stimulated by scientific evidence about the dangers of smoking to health, evidence of the dangers about secondhand smoke, which galvanized non-smokers to care, evidence of the tobacco industry duplicity, and a progressive denormalization of smoking. Next, please. So there was a study in the Journal of the American Medical Association in 2014, which was an issue that commemorated the 50th report of the Surgeon General, and it showed the benefits of tobacco control over about a 50-year period. So the policies prevented about 18 million deaths. There were about 18 million smoking-related deaths occurred. There would have been about 25 million had those policies not happened. And there were major life expectancy gains during this period, 30% of which were directly due to reduced smoking. But people with mental illness or substance use disorders did not benefit as much from these declines in smoking rates. Next, please. So this is a review of the federal tobacco tax, which was low for a long time until President Obama signed a bill in 2009, raising it from 39 cents to $1.01. Next. Can I have the next slide, please? So this shows, and I'm going to call out the 7 states that are represented in this call, but this shows extreme regional differences in state tobacco taxes. The average is $1.79. California just went up to $2.87. It is now 10th highest. Florida is $1.34. It is 31st highest. Kentucky is $1.10. It's 36th highest. The folks in the Show Me state are not in the Tax Me state. They're 17 cents, and it's the 51st, so it's the lowest of any of the states. South Carolina is 57 cents, which is 45th. New York is $4.35, which is second only to the District of Columbia. So for those of you in the low end, there's a lot of room to improve. Next, please. And this just shows a lot of regional differences in smoke-free states and smoke-free local ordinances. And in general, there's a move towards more smoke-free. Once an ordinance is passed, it's very difficult to turn it into letting smoking happen again. Next, please. Counter-marketing campaigns seen in television and some billboards occur in states such as California, the Truth Campaign, the CDC Tips from Former Smokers campaign. And with all of those, when they air, there's a huge spike in calls to the quit lines. Now, the FDA was given the authority to put new package warnings in. And if I can have the next slide, this was a very hard-hitting package warning showing a smoker, a man who'd had a tracheotomy, still smoking and exhaling through his trach site. Unfortunately, a local court said these weren't legal, and so the FDA is back to the drawing board, but they've been, another court has said they've got to come up with new warning labels, so you should stay tuned. These should come out soon. Next. Now, there are tools for smoking cessation. Remember the little slide to help people quit. They're the 5 A's: ask, advise, assess, assist, arrange, and you're going to have another webinar on that. Ask, advise, refer, which collapses assist and arrange to send to the quit lines or to a local system such as Kaiser has. There's nicotine replacement therapy and other medications. There's counseling and behavioral change strategies, and there's peer-to-peer intervention. So I think the next slide is the final slide. And it just shows you that there are a lot of policies, and one of the reasons we've done so well and have dropped so much in smoking prevalence is because of those policies. And you have the ability in your states and your communities to serve as advocates for these. So I will stop now, and I think, Becky, there may be time for questions.
3 minutes.
Yeah, so a few minutes for questions. That's great. Thanks so much, Steve. Any questions about our presentation?
Steve, this is Sharon. I think the only other, it was good. I appreciated that. The only other thing is I've heard another acronym as well, which is Ask, Advise, Connect. And I think that people are using that. It's a referral, but the idea of being some kind of electronic referral. So that's just the newest one, I think.
Yeah, the whole thought behind that, and it grew out of work we had done, is that a lot of clinicians are very willing to ask and advise, and then they get bogged down and feel they don't have the time to do the third, fourth, and fifth A. And so if they hand it off, those get done by somebody else, and that's an attractive option.
Yeah, agreed.
Questions in the chat box.
That's great. The states and the tobacco tax, I always find that interesting to see where everybody fits and the different climates. So that was great, Steve. Any other questions?
Hi, this is Linda Bailey. Can you hear me okay?
We can.
Okay, thank you for a great presentation. You know, as you were talking about policy interventions, it reminded me of some work that Dr. David Mabry, Dr. David Lee did back probably 5 or 8 years, where he looked at the additive effect of doing more than one intervention and really found that if you're doing policy interventions as well as intensive cessation services, you can really get a payoff, an additional payoff from doing all those activities together. And I wonder if you've had any experience or have anything to add about really implementation of more than one policy and service intervention at the same time.
You're correct.
That's great. We know that's always like the multi-component interventions, right? From several different places make a big difference.
It's one of the reasons states like California and others, Massachusetts, have such low smoking rates, because they managed to pile in all the policies.